Hello everyone. This is Dr. A. Ramya, Assistant Professor, Department of Pharmacology from Vistas. In this video, we are going to see about factors modifying drug action. The first factor is body weight. The recommended dose is calculated for medium built persons. For obese and underweight persons, the dose is calculated with the formula dose is equal to body weight in kg into average adult dose divided by 70. The second factor is age. The pharmacokinetic of many drugs change with age, resulting in altered responses. In infants and newborn, the liver and kidneys are not fully matured to handle the drugs. Example, chloramphenicol can produce gray baby syndrome. The blood-brain barrier is also not well formed that causes the drug to reach the brain. The dosage for children are calculated using Young's formula and Dilling's formula. Young's formula is equal to age in years divided by age plus 12 into adult dose. Dilling's formula is equal to age divided by 20 into adult dose. Calculation of appropriate dose depending on body weight will prevent toxic effect. In pediatric people, the capacity of liver and kidney to handle the drug is reduced and they are more susceptible to adverse effect. Hence, lower dose of drug are recommended. Elderly people are administered with higher dose of streptomycin. They have a high risk of developing ototoxicity, that is toxic to ear, and nephrotoxicity, toxic to kidney. The next factor is sex. There is no gross gender difference in response to a drug. In women, the hormonal effects and smaller body size may influence the drug responses. The women who are pregnant, lactating, and menstruating should be cautious about the doses. Example, purgative causes pelvic congestion, and if they are taken during menstruation, they may increase the menstrual blood loss. The fourth factor is species and races. The response to drug varies with different species and race. Example, rabbits are resistant to atropine, which causes difficulty to extrapolate the results in animal experiments. Variation in response to drugs is seen in different races. The black people need higher dose of atropine to produce mydriasis. The antipsychotic clozapine may cause a higher incidence of agranulocytosis in people of Finland. Diet and environment. Food interferes with the absorption of many drugs. Tetracycline forms complex with calcium present in the food. The polycyclic hydrocarbon present in cigarette smoke may induce microsomal enzyme resulting in enhanced metabolism of some drugs. The absorption of drugs like spironolactone, chloroquine, and riboflavin, lithium, albendazole is increased when administered after the food intake. The absorption is reduced when drugs like ampicillin, rifampicin, tetracycline, iron H are taken after the food. The sixth factor is route and time of administration. The route of administration of a drug modifies the pharmacodynamic responses. When magnesium sulfate is given in different routes of administration, the response is also different. When magnesium sulfate is taken orally, it is purgative, but when it is administered in IV, it causes CNS depression and has anticonvulsant effect for which it is used in eclampsia of pregnancy. When it is applied topically, it reduces local edema. The hypertonic magnesium sulfate retention enema helps in reducing the intracranial tension. Time of administration. Several diurnal variation in the body and the time of drug administration is important to obtain the benefit of such variation. Example, Secretion of glucocorticoid is highest in the morning. When exogenous glucocorticoids are also administered in the morning, it results in the reduced HPA axis suppression. The seventh one is genetic factors. Pharmacogenetic is the study of genetically mediated variation in drug response. Genetic polymorphism or variation affects both pharmacokinetic and pharmacodynamic of the drug. In pharmacokinetic, it changes the drug absorption, distribution, metabolism, and excretion. In pharmacodynamic, it causes variation in receptors, enzyme, susceptibility to disease, and adverse drug reactions. The eighth factor is dose. Response to a drug may be modified by the dose administered. As the dose is increased, the magnitude of the drug response also increases proportionately till the maximum is reached. Further increase in dose causes the drug to produce an opposite effect. Example, in myasthenia gravis, neostigmine enhances the muscle power in therapeutic dose, but in a higher dose, it causes muscle paralysis. Physiological dose of vitamin D promotes calcification. When it is administered in a hyperdose, it leads to decalcification, which is an opposite effect. The ninth factor is diseases. Presence of certain diseases can influence drug responses. Example, gastrointestinal diseases like malabsorption causes poor drug absorption. In liver diseases, rate of drug metabolism, including first-pass metabolism, is reduced due to dysfunction of hepatocytes. Cardiac diseases like congestive cardiac failure, there is a edema of gut mucosa and decreased perfusion of liver and kidneys that causes accumulation and toxicity of drugs like propranolol and lignocaine. In renal dysfunction, there is accumulation of drug that leads to toxic effects. The 10th factor is repeated dosing. When a drug is repeatedly administered, it may result in accumulation, tolerance, tachyphylaxis, and resistance. Accumulation. When a drug is repeatedly taken and elimination is slow, it leads to accumulation in our body, resulting in toxicity. Example, digoxin. Resistant. Repeated administration of an antibiotic can result in reduced or no response to it, and this could lead to life-threatening infections. Tolerance. It is developed when the drug is repeatedly administered. It is classified into natural tolerance and acquired tolerance. Natural tolerance. Species or race show less sensitivity to the drug. Acquired tolerance. It is developed on repeated administration. Example, morphine and barbiturates. Mechanism of tolerance is of two types, pharmacokinetic mechanism and pharmacodynamic mechanism. In pharmacokinetic mechanism, disproportional tolerance is found. It is defined as effective concentration of drug at the site of action decreases mostly due to elimination of the drug. Example, barbiturates induce microsomal enzyme and enhance their own metabolism. In pharmacodynamic mechanism, functional tolerance is found. It is defined as the function of drug gets reduced when the targeted organ does not respond properly. Example, blunting of response to the some antihypertensive due to salt and water retention. The 11th one is psychological factor. Doctor-patient relationship influences the response to a drug. Placebo is the inert dosage form with no specific biological activity but only resembles the actual preparation in appearance. It is used in clinical trial as a control to benefit or please a patient psychologically when he does not actually require an active drug, as in mild psychosomatic disorders. Nocebo. When an established drug fails to produce its known therapeutic effect, it is often referred to as nocebo effect, which means it is opposite to that of placebo. The last factor is presence of other drug. The concurrent use of two or more drugs can influence the response of each other as it results in formation of drug interaction. The outcome may be harmful if the interaction causes an increase in the toxicity of the drug.